More than 1.8 million people live in nursing homes in the United States today. By the year 2030, the number of people over the age of 65 or older will nearly double to more than 70 million, creating a greater demand for nursing homes and elder care services across the nation. Designed to provide skilled medical care and assistance with daily activities, the typical model of nursing homes has changed significantly over the years, and today, many facilities are now considered to be more like home for their residents.
Nursing homes of the past used to be very institutional-like. It was a place where residents came for just end-of-life care. Today, nursing homes are home-like. They offer hands-on approach, lots of activities and care centered for that individual. Skilled nursing facilities are designed to be social places for residents to continue living their life just like they would do at their home. But now they're here in a safe environment with friends and family who care about them, love them, and watch over them.
Today, the nursing home industry recognizes the need to create a positive perception about their facilities, not only for their residents and family members, but also the general public.
Nursing homes now are completely different of how they used to be in decades ago. It's really about focusing on changing the culture and the environment that they used to be. And facilities now and nursing homes now are really centered on engaging the resident and continuing their life.
Even in many rural parts of the United States, nursing homes have already changed the way they are managed and organized to provide exceptional care and quality of life for their residents.
I'm cold. I'm hot. I need my medication. Could you get the doctor for me?
Deseret Health Group, a long-term care provider with locations in communities across Kansas, Minnesota, Nebraska, and Utah, is dedicated to making their facilities a home for their residents.
Our community-minded facilities feel like home for people because they're able to stay in the rural communities that we are in, primarily as Deseret. They don't have to move to a more urban area and leave their friends and family. Another way that we help do this is by employing local people. And so when the residents are in their home here in the facility, they get to see familiar faces, and that just makes them feel more at home.
Deseret Health Group is also committed to being an asset to the communities that surround them by being a good corporate citizen.
We bring good values and strengths to our communities because we really offer a sense of community. We encourage our staff, our employees, and colleagues to volunteer their time, their energy to clubs and organizations and schools, senior centers. From our home office to our facilities, we really strive to build and sustain a healthy society where we live and work.
Our organization is improving rural communities by giving back to the communities. Some of the examples of what we do is sponsor local youth activities, assist in fundraising events throughout the community, being active in local organizations such as city councils, chamber of commerces. By just being a facility within a rural community, it provides jobs, and often we are the largest employers in our communities, so that also helps improve our communities and becomes as a leader in being efficient and managing business as well in our communities.
While serving the needs of rural America is at the core of Deseret Health Group, the organization is also continuously searching for ways to integrate new technology to improve their systems and overall efficiency in managing their facilities.
With Deseret, we have established a program called DH Tools that helps us become better managers. We are able to better manage our budgets, our labor, and our quality of care through operating through our policy and procedures and standards of care.
In terms of some of the particular things that we've done, just the clinical auditing process is, finding deficiencies in your medical records and making sure that the proper interventions are taking place for the residents. It's a hard thing to get your head around, even if you're using electronic medical records, because there's just so much data to go through. So a lot of the systems that we've built and designed are proactive about finding those errors and pointing them out so that we don't have to worry about the nurses finding them. We can just tell them, here's where the issues are, Now you can go fix them. It saves a lot of time and just lets them take that time and use it for better things, like actually caring for the residents instead of pushing paper.
Another unique aspect of Deseret Health Group is their strong desire to invest in the lives of their workers, from department heads to their nursing staff.
The Deseret Health Group helped me further my education by encouraging me to step up from the business office manager to the administrator's position, and in doing so, they have financially provided me the ability to go back to school to obtain my bachelor's degree to do that.
Deseret Health Group plans to continue to expand its elder care services across underserviced populations in rural America by converting distressed nursing homes into successful, high-quality nursing and rehabilitation facilities.
We've made a strong business out of being in these smaller rural communities and taking businesses that are struggling and still adhering to some of those old institutional stigmas of the past, and hopefully in years coming that would provide us many opportunities to continue to grow and change the way healthcare is delivered in rural settings.
The most I love about the Deseret Health Group is our residents. Just seeing that they're happy and well cared for. They've always been the top priority in our company is resident care and making this a happy place for them to live.
To learn more about Deseret Health Group, visit DeseretHealth.com. A passion for life, a place for caring.